Hello everyone, welcome back to another video with me. My name is Deanna. I'm your Estie with the bestie. Okay, today's topic is super concerning to a lot of people. It is pigmentation. I can't wait to tell you guys more about it. But before we begin, I need to put out a little disclaimer out there. So this video is in no way to substitute to go see an esthetician or a dermatologist for proper diagnosis and a proper skin analysis, because they need to physically see you in order to treat it, in order to provide proper skincare routine. So please go see a dermatologist or an esthetician. This video is just to scratch the surface and provide for more information on how you can prevent it from happening or what may be causing it, ingredients you can focus on in your skincare, what you can do at home, nourishing your body with different foods to brighten your skin. So yeah, let's get started with pigmentation. So when you go see an esthetician or dermatologist, you may see a skin analysis technology. It's a machine that can take detailed imaging of the different layers and concerns of your skin. Also scary, but true, the age of your skin versus your physical, biological age. That is scary. But to be a little bit more vulnerable with you guys, I decided that I'm going to post mine right here. So, as you can see 8 different photos, all addressing different skin concerns. The different skin concerns that it may provide are redness, which is a type of pigmentation, sunspots, age spots like wrinkles and fine lines, pore size, scary, sun damaged skin. You can see in the photos that my left side is definitely a lot more damaged than my right side. Why? Because this is my driving side. This side spends a lot more time in long periods of sun exposure. Sun can do a lot of damage to your skin, and let's get me started on that because we can go on and on about that. The machine is called a Vizia. At least that's one of the most well-known ones. So if you guys do see it, please go ask them if they can get a complimentary one, because it can really show you how and where to mainly address and focus on when you're getting treatment done. There's several different pigmentations I wanted to talk about. So the first one is UV-induced pigmentation, hormonal-induced pigmentation, PIH, post-inflammatory hyperpigmentation, PIE, post-inflammatory erythema. So those are 4 different types of pigmentation that you can be getting. So let's address why. I want to talk about melanin, which is the pigment, the dark pigments that you are getting. So those are the most general pigments that you should be seeing as pigmentation. The dark spots, the age spots, the liver spots, melasma. I will kind of indicate like what they are specifically in those 4 types of pigmentation. So melanin is produced by overactive melanocytes, and this can be produced by tyrosinase enzymes, which helps form the melanin in your skin. Melanocytes are overactive when the sun is hitting your skin, and that is a way for your skin to cope with the UV rays, the damaging rays, the sun exposure. It's creating an umbrella to protect your skin. So a couple different things you want to know is there's 3 different UV rays. There's UVA, B, and C. I like to define them as A as in aging, B as in burning, and C as in cancerous. So the third one is one of the most dangerous rays that you can find, but it doesn't hit the earth. It does come from the sun as well, but it doesn't hit the earth because our earth is protected by our ozone layer, which thankfully is still there. We can get onto that in another video, but it can be man-made as well. So like your microwave, for instance, the reflections from our electronics and stuff. So those are all man-made and can become cancerous. UV rays. The different types of UV ray pigments that can come, the phthalides, which are freckles. Some people are born with freckles, but majority of people develop freckles later on in life. We also have age spots or liver spots or tanning. The tan you get, those are all from being in long exposures to the sun. Let's talk about hormone-induced pigmentation. It can happen during pregnancy, but it can also appear after pregnancy. It can be caused by hormonal imbalance or if you're on birth control. These are types of hormones that can cause this type of pigmentation. Melasma is a type of hormonal-induced pigmentation. It's called masking on the face, also called the butterfly mask. It starts with dark pigments on the higher cheekbones or the forehead and spreading across these areas. If you see that, you want to make sure you go see a dermatologist and get yourself some medication or topical cream for it, or get the right treatments to treat it, and we will talk about that later on in this video. The next one we want to talk about is post-inflammatory hyperpigmentation. This is a pigmentation that is caused by any injuries, any burn marks, as well as acne scarring. This is just overworked melanocytes that be caused by serious injuries to the skin. There's a pigmentation called solar lenticle, also known as H spots or liver spots. This is when an excess melanin appears later on in life, so you can see this more in mature and older clients. This is why estheticians always tell younger clients preventing is better than repairing. No one has the patience to see the results and stick with the strict skincare routine that you have to be on in order to see the results. It's definitely something that you really have to work closely with an esthetician and just being able to stick to that skincare routine. PIE, post-inflammatory erythema. This pigment can appear after any inflammation, also more common in lighter skin types. It's not melanin or any dark spots, but appears in red or pink color. This is due to any dilation of blood vessels, broken capillaries or blood vessels in the skin, and this is why it appears more on lighter skin types. How can we treat pigmentation? Well, there are several treatments that I want to recommend you, and the first is a chemical peel. It is a clinical form of exfoliation, but also helps treat your pigmentation. You want to stay out of the sun for 1 to 2 weeks prior to your treatment and with no inflammation. There are 2 ingredients that you can look for in a peel. There are 2 ingredients that you can look for in a peel, one being glycolic and the second one is lactic acid. They're both great for exfoliation and anti-aging, but both target pigment and brighten up the complexion. The second treatment is microneedling. It creates controlled micro wounds in your skin that promote healing and collagen production. It also targets the pigmentation and breaking it up and promoting cellular renewal, which exfoliates all of that pigment out, which is great for people with melasma because again, it is a hormone-induced pigmentation. The third thing is laser treatment. Laser treatment is really good for post-inflammatory hyperpigmentation, so PIH and PIE. It helps target pigmentation, but also helps target redness and minimizes redness and pores. These are great treatments for you to find if you have any pigments. Of course, ask your esthetician or ask your dermatologist before you go ahead with it. And any medication you are taking, definitely bring those up as well because it can be contraindication to these treatments. Let's talk about ingredients in your skincare that can help prevent and better your pigmentation. So you want to find ingredients that are tyrosinase inhibitors. Tyrosinase is an enzyme that is crucial for melanin production. So when you're blocking these enzymes from working, it's blocking your pigmentation from showing up and for the melanocytes to produce melanin. So you want to find ingredients like vitamin C. Vitamin C is one of the top ingredients that is introduced in most people's skincare because it helps not only just brighten up the skin and your complexion and evens the skin tone, but it's a really great duo with sunscreen for antioxidants as well as the perfect duo for anti-aging properties. The second one is niacinamide. Niacinamide is really great for a light exfoliation. It's more recommended for oily skin types, but it helps with brightening as well. So something for more sensitive skin types or post-inflammatory hyperpigmentation would be azelaic acid. It's a more gentle form of exfoliation and brightening properties. The fourth one is kojic acid. It helps fade dark spots and also brightens up your complexion. And some other ingredients are licorice root, mulberry extract, or rubitin. The last ingredient I want to talk about is hydroquinone. Hydroquinone is a topical medicine that helps with discoloration. You can get lower dosages over the counter or from the pharmacy. You can also get higher dosages from a doctor if you have more serious injuries. Let's talk about foods that can nourish our body to help brighten our skin as well to prevent pigmentation. I just wanted to let you know that I did collab with a fitness and nutrition coach who's certified in the States. If you guys want more information, I will link it down below. So let's move on. She did mention that this is not just for everybody. It's for somebody who is more healthier. If you do have dietary restrictions, this may not be for you as well. But again, just a little beware of these things. So the reason why you could be having pigmentation is probably from a copper deficiency. So you want to find something that is rich in copper foods. So such as organ meat, like liver specifically, nuts and seeds, any seafood, cocoa, chocolate, legumes, and mushrooms are all really great. This concludes our video. So thank you so much for watching. If you guys have further questions, comment below, email me, whatever it may be. Let me know in the comments what you want to watch next. Thank you so much. Bye.